And now to the most awaited, coming at position 1 is none other but
Climate Launchpad is one of the world's largest green business idea competition, whose mission is basically to unlock world clean technology potential that addresses climate change. So Climate Launchpad has been here with us as Kenya Climate Innovation since 2017. But globally, they have done a number of 7 editions actually. So KCIC and Climate Kick, who are the initial proponents for Kenya Climate Innovation Center, actually started this competition just to ensure that they create a global community of innovators who are determined to address the impact of climate change through entrepreneurship. We have teams that will be pitching to us in different thematic areas so that we can be able to pick the 2 that will then from each thematic area that will then pitch in the finals.
My name is Bernard Mucheke, the Executive Director of Community Shelter Works.
My name is Godfrey Simiyu Katiambo, the founder of Inonit Limited.
I am Esther Wanjiru Kimani, and I present a solution, Zero Carbon Boards.
My names are Japhet Mucheka, the CEO and founder of Irismart.
My name is Margaret Wanjiko from Kingdom Clothesline.
My name is Ian Ruthi, and our business idea is rethinking how drinking water is packaged in a bid to reduce plastic waste.
Growing up in rural regions of this country was quite challenging for our family, as we had to rely on kerosene for lighting and firewood for cooking. This posed other issues like health issues among the family. Climate change knows no boundary. In order for us to achieve substantial growth globally, we need to work with the inclusion of rural communities. Our deal: at Clean Energy for Food Security, we provide affordable off-grid energy services to off-grid rural households at a price of 6.8 euros cent per unit. Our beachhead market is Kenya, where we expect to work with 200,000 rural off-grid households between 2021 and 2030, therefore generating a profit of 9.8 million euros. Later on, scale out in East Africa region between 2031 and 2036, among 600,000 rural off-grid households, generating a profit of 29.4 million euros. And in later stages, rollout in Africa between 2037 and 2042, among 1 million rural households, generating a profit of 48.9 million euros. At 300 euros per unit, our product is the most cost-effective energy storage compared to other existing clean energy storage products in the market. By using our product, our customers are able to save 82.6% in comparison to kerosene and 50% in comparison to other existing energy storage. Furthermore, our product is more eco-friendly as it recycles clean air, and also it provides cool air which can be used for storage. It has 2-in-1 services where it can produce energy and refrigeration at the same time. It cleans the air. Also, it's energy efficient because if you have input of 1 kilowatt, you can release 3 kilowatts output. It's also cost effective because at a cost of 300 per kilowatt, you're able to provide electricity. Currently on patenting and licensing, our product uses clean air to drive the compressor. Air is stored and compressed at 250 bars in the compressor chambers, and energy is at the same time electricity is generated for household usage, and also cool clean air is generated for cold storage component. At night, compressed air is released, thermal energy energizes the air to generate electricity, which is still used for the household communities, and air as a byproduct is tapped for the cold storage facility. In order to understand our product, we had to interview 1,200 rural off-grid households. During our pilot phase, we had key assumptions. Households lack access to energy power, and also there was anticipation of cooperation from the local and central governments. Major key learning into this was the need of extra services among the communities, and also there was need for service development and communication engagement among the community, where we expect to use pay-as-you-go model as a model for our payment. With 40% of our beachhead market, we expect to generate a profit of 9.7 million euros. Key Key drivers to this is lack of access of other modern energy services, and also we are guaranteeing a reliable low cost of energy. And also there's need for other services such as crop loss prevention and management at a lower cost, and also charging apps for the phones. With 40% of our beach market and average usage of 70%, we save 12,630 tons of carbon dioxide emission, thereby reducing carbon footprint by 89%. Team and founder's dream. We have I, Bronson Arogwa, also the co-founder, risk analysis and management of the program, with over 7 years experience in project management. We have Professor Willis Owino, who is the cold storage component lead, with over 20 years experience in food technology and post-harvest technologies. We have Dr. Patrick Mbedio, who is also the clean energy technical lead, with over 20 years experience in clean energy technology. Rachel Olwanda, also the co-founder. She's also in charge of strategy and business management, with over 18 years experience in strategic development with UN bodies. We have Esther Mareka, who is also a co-founder, business development and financial officer with over 14 years experience in portfolio management. Founder's dream, we aim to provide decentralized renewable energy to 1,000 off-grid households within 2 years, increase the proportion of renewable energy in the national energy mix by 1,567 megawatts in 5 years, and last but not least, establish a network of 400,000 off-grid energy households in 8 years.
I think it's a great solution that you're providing. The solution is clear, the problem is clear. About now, how to practically roll it out. Have you thought about now what would mean for your competition? Who are your competitors? And then, like in our offices here, we have solar, yeah? We have more energy than we need, but we are not able to distribute the extra energy we have to the nearby households. So are those challenges that you have looked at and found ways of mitigating them or going around them?
Yeah, thank you. Actually, now that's the solution which you're providing, because currently you're not able to tap the solar, which is generated excessively through the FAB's free air battery. It doesn't use any lead acid, it doesn't use any ions, it's just air, which is taps and compressed in form of energy. Then later when we need the energy, it is released as cool air and clean air, which ionizes the air and electricity generated for household for later use.
Okay, so you've not looked at any foreseeable challenges and found ways or any risks in rolling out your business?
We had some challenges. The good thing we did piloting in Embu, and one of the challenges was the solar. We realized there was quite, when it is less solar, it was quite challenging. Our product will produce up to around 10 hours production in terms of the energy. But right now, as you're talking, we scaled up, we add additional compressors whereby it can store energy to produce energy up to 16 hours, but we still to again research further so that we can have at least around 48 or between 36 to 48 hours in terms of production, so that we can be able to maximize the little sunlight available in the regions within the continent.
Hello everybody. Imagine waking up every morning at 4 a.m. and walking miles and miles in search of clean drinking water instead of preparing for school. This was my reality. It is a reality for many of my cousins and sisters. Do you know 9.9 million Kenyans drink directly from contaminated water sources? 80% of diseases are waterborne related and leading cause of death among children under the age of 5. Reality is climate change is already here. Water scarcity, floods and droughts are displacing mostly the already vulnerable communities. So to adapt and have resilient communities, we have come up with an end-to-end solution, Maji Safi ATM. The deal. We provide decentralized water management services to middle-sized schools and institutions for €80 per month. With one stone, we let two birds fly. We bring water and education together. Our beachhead market starts with the western part of Kenya, home to Lake Victoria and major water tributaries. By 2026, we believe we can have active services in 2,700 schools, making an annual profit of more than €1.5 million. We have the potential of growing up to €7.5 million worth in emerging markets. Customer value proposition. Schools are central in terms of location and population around the water sources. Efficiency and services are the key to unlocking this potential. Therefore, We are cutting our niche in the market with our services and monthly maintenance cost. We are 85% cheaper to our customers compared to NFC ATM. We are a standalone solution, pay and go, refill, no landfill, no daily vendor, no tokens, and no internet needed. Other social impacts are more children have access to clean and safe water, a cleaner environment devoid of plastic pollution. More children, especially girls, will attend school. You educate a girl, you educate a whole village. Our product, Majisafi ATM as a water treatment component, meaning we can operate from any water source, be it borehole, surface water. It is easy to use with 3 taps, remotely controlled. It is fully automated, solar powered, and based on cloud services system control. The user chooses in local language the quality of water and the liters. M-Pesa mobile money is integrated. It enables the user to pay with any type of phone. Our customer is provided with a real-time data dashboard. Our competitive advantages are we are licensed and have tested our prototype at different locations. We embrace traditional banking system, Kosalo. It is water banking, not just buying water. The hardware is durable in all weather and made from upcycled locally available materials. For our customer discovery, we did more than 30 interviews at our pilot locations, 8 schools, 2 hospitals. Parents do value their children drinking water, clean water. What we learned, schools spend large amount of money on health issues. Schools can adapt to water harvesting because of massive rooftops and boreholes around schools. My mother wanted a future for me. So do all the parents for their children. Financials. In our beachhead market, we will make an annual profit of more than 1.5 million euro per year. With 2,700 customers, we're looking at a profit of 550 euro per customer per year. Our beachhead market counts for 18,000 schools. We expect to have a 15% market share. We aim to serve the customer for at least 5 years. This gives a profit of 2,700 euro per customer and the life of a customer with a churn of 3%. Climate impact. Instead of communities walking far to collect non-revenue, untreated water and boiling it with firewood, we provide treated water. The difference in impact is calculated per year and the total impact is calculated for 33 million liters of water, saving 1.3 kg CO2 per liter. We save 44,000 tons of CO2 emission per year. This equals to 2 million trees. Our solution will help people to adapt to water scarcity, mitigate deforestation, and connect human development with the biosphere. The founders' dream and team. We are 5 co-founders with diverse backgrounds and with more than 10 years of experience. Andrew, lead in logistics and financial administration. Valerie, environmentalist and water specialist. Saskia does project management and education design. Christine, our tech guru, and me, the community sales and marketing lead. We dream to make clean and safe water accessible and affordable to more than 5 million underserved population by 2026. Cut down deforestation by 60% within the community served. Achieving a valuation of 4.5 million euro by 2026. I believe ending poverty begins with clean water. Thank you.
Well done. I've liked your presentation and the passion in it. Mine is just a question. Are you planning to do integration? Because I thought it's actually a proposal, not a question. Are you planning to integrate your water ATM to water harvesting solutions for schools and institutions? Because I think that would work very well for you. And possibly at household level, would you get small units that could replace the water dispensers that we know of?
Thank you so much, Jess. I'm just so excited about your question as well, because when we went with the water purification to schools, most of the schools, the first thing they said is like, we don't have water source. And what we have is just borehole there, and in dry season, it really gets really dried. And apparently what's really good about the climate change, it also woke people up. If you look at the school roofs, they have a massive roofs. And if you can harvest this water, which we did because we started from water purification. So we did 14 schools, and immediately they become actually water secure schools when we were doing purification before we moved to our innovation of the ATM. So water harvesting is one of the areas that actually schools, hospitals, big community churches, there's so much rooftop, and they don't connect this to even the floods filling Lake Victoria from the Homa Bay where we come from. So if you can harvest this, it would be amazing. But also we have small units that, for homes that would be, we have not really reached there. But I hope that when we reach that bridge where we're able to do it in the homes, would be such a brilliant thing. You know, you look at Kenya, people still really don't drink really clean water, and they don't connect that to health. So I think a lot of people would appreciate that as well. But now, because of urban solution, we're also looking at really big, and that's why we even use like our system is actually integrated with M-Pesa, where we use the normal Nokia to really serve the people. But thank you so much for that. I think that's a brilliant way to look for future innovations as well.
When I gave birth to my baby in 2018, I faced a lot of challenges getting her vaccinated. I live in the rural Makueni, and sometimes our clinic turned us away because the vaccines had spoiled. The clinic faced unreliable power challenges. Today, Kenya needs to vaccinate each and every single citizen against the COVID-19. As a country, do we have the infrastructure, the energy, and the technology to deliver such a kind of program? My name is Nora Magero. I'm the co-founder of Efficient Cooling, Equal, and we're bridging the cold chain gap in healthcare. We're selling a portable solar vaccine fridge called VaxiBox to healthcare facilities at 630 euros per fridge. In the beachhead market, Kenya, we're targeting 7,000 healthcare users by 2024 at a valuation of 4.4 million euros. These healthcare users include level 3 and below healthcare facilities, dispensaries and pharmacies that can conduct vaccinations, and blood banks. In East Africa, we're targeting 40,000 healthcare users by 2026 at a valuation of 25.2 million euros. And in the rest of sub-Saharan Africa, we're targeting 200,000 healthcare users by 2030 at a valuation of 63 million euros. VaxiBox is offering to reduce vaccine wastage by 80%. To serve the beachhead market, every year, VaxiBox will create electricity savings of 633,500 euros to keep vaccines cold. VaxiBox is portable, it weighs 20 kg and has a capacity of 40 liters. It can easily be mounted on a motorbike, bicycle, or a boat, so that blood, vaccines, and other healthcare items can be deployed to the remotest, most off-grid, and hardest to reach healthcare facilities and communities to supply equitable healthcare services. It keeps vaccines cold 24/7, it's solar-powered, and comes with a 12-hour battery backup. It's integrated with a data management platform, a remote monitoring and data collection capability through internet, Bluetooth, and GPS. And the most important thing, VaxiBox is locally manufactured here in Kenya. This allows us to give a solid after-sales support structure for our clients. So we're in the process for applying for a patent. We interviewed 250 people, including nurses, patients, and healthcare administrators. What we learned was that VaxiBox will increase weekly vaccinations by 150% and also increase cold storage capacity by 80% while promoting accurate data recording and collection. We also learned that these rural facilities transport vaccines from the repository to their facilities each week. They also form 70% of the healthcare institutions that lack reliable power. They also face bias and inaccurate data capture methodologies. In our 5th year of operation, at a product price of 630 euros per fridge and a profit margin of 291 euros per fridge, by capturing 50% of the market to supply 20,000 VaxiBox units, we foresee generating an annual profit margin of 1.94 million euros, with the key value drivers being the net profit, the live customer years, and the market share. By capturing 50% of the market, of the beachhead market, VaxiBox will save 151,400 metric tons of CO2 from being released into the atmosphere. This is equivalent to not burning 300,000 barrels of oil to generate electricity. In a nutshell, VaxiBox is reducing carbon emissions by 84% compared to generating electricity to keep vaccines cold. And the team to deliver this is myself, Nora Magero. I have 6 years of experience in the energy industry. James Mulatia is a product development manager and has 6 years of experience in the healthcare industry. Ivy Siovata presents over 10 years of experience in the healthcare business development, while Abigail Mbula has 2 years of experience in research and development. Our dream is to equip 40,000 healthcare facilities in sub-Saharan Africa by 2026 with a VaxiBox fridge. This will in turn inject an additional 2,000 jobs in the manufacturing, energy, and healthcare industry by the same year, and also see us have a valuation of 9.7 million euros by 2026. With VaxiBox, I know that my daughter, any child under the age of 5, and all Kenyans stand a chance of being fully vaccinated. Thank you.
My question is on data capture. How is VaxiBox integrated in terms of managing whatever contents will be in there? Because we know that the medical field is quite sensitive. So does VaxiBox come with an integration with hospital data? Are you able to monitor what goes out and what comes in of the VaxiBox? Number two, why VaxiBox when we know that most, if not all, medical facilities are equipped with, or rather, what is the niche from the sample of 250 customers that you did? What is the demand like for VaxiBox? I don't want to be ignorant and say most have. Let's see the figures you corrected from your 250 customer sample. But I like the idea of preserving vaccinations and meds using solar. I like it, but I would want to be clear on those two areas that I've mentioned. Thank you.
Okay, thanks so much. First of all, the data capture methods and data management. So VaxiBox is integrated with something we call a smart box. It's a communication device that is able to capture the temperature of the fridge, when the fridge door is open, what stock is inside within a VaxiBox unit, and also able to record the state of charge of the battery at any one point. And all this is stored in a cloud-based platform. And we give access rights to the facility that subscribe to our platform, so that at any one point, the healthcare managers are able to monitor what's going on at the vaccine fridge. Is it off? Is the door open for too long in whatever location or facility? And also, the other people who will get access to the management is the district public health nurses, because they're the ones who are in charge of the vaccine data at sub-county levels. So we give them subscription rights to be able to see what's going on. Then on our end, we'll be the one who will be able to see the data that is coming in inside the cloud, because we own the cloud platform. And also, healthcare data is very, very sensitive in any African country or even in any country. So we will definitely work closely with the county government, or even just the national government and the Ministry of Health, to see how we can protect this data further, and even if they be part of the ownership of the data that we receive, whether it's the vaccine stock or the state at which vaccines has been kept. I hope that has been answered, but I'll be able to expound more. Then also, why the VaxiBox? And I like the fact that there's so many healthcare facilities that are actually getting powered with electricity and also with solar systems. So now, still there is a market of healthcare facilities that do not have electricity completely, so they have to depend on solar. So VaxiBox come in handy for them, and we are also targeting the dispensaries that will soon graduate to be able to carry out deliveries of newborn babies who need to be vaccinated, or tetanus needs to be stored in appropriate storage for the mothers. And there's also the market of these facilities, the level 3 and below healthcare facilities, being able to conduct vaccination in the field, which is really, really necessary right now, even in the times of COVID. So they'll be able to check this box, even if they have another larger fridge at their facility, but they'll be able to take the vaccines in the best state, not keep them in the cold boxes with ice packs and worry that the ice packs are going to melt. But the VaxiBox will ensure that when they mount this box in the vehicle, on a boat, going to an island, or on a bicycle or a motorbike, and they get to site, they'll continue conducting vaccinations, knowing this unit, the fridge, is keeping the vaccines cold in the most appropriate temperature to ensure that the vaccines that are issuing are actually maintained in the appropriate potencies of VV1 and VV2. Currently in Kenya, what we find that most, I think over 90% of the vaccines that we get is at VV2. VV2 is the level of potency. VV1 and VV2 is best given, then VV3 and VV4 is bad. So most vaccines we get at VV2, which is just borderline to VV3. But you want to up that potency for vaccines that we get to VVM1 by ensuring that even from the repository to the health facilities to the site where vaccines are being conducted, the vaccine is kept in appropriate temperature 24/7, with no fear that the temperature fluctuations to make it less potent. We have, sorry.
Yeah,
yes.
Well, you're still there. So this box has an alternative power source, just in case, because solar is the sun. If the weather is not permissible, what is the alternative power source?
It's a battery. This box comes with an inbuilt battery that is able to last for 12 hours currently, and we hope even to be able to increase that battery capacity to go lower in terms of when there is low solar resource. Like we've had periods of low solar resource in Kenya, and even the pilots that we're conducting in site is giving us insights on how we need to increase the capacity. It's called the cooling capacity of a fridge. And also, we will ensure that with the better modification and designs of VaxiBox, we increase something called the holding time. Holding time is literally the last resource. If there is no sun for a few days, the battery has died or it has spoiled or the solar or the electricals have failed, how long will this fridge be able to keep vaccines in the best potency, in the best cold storage? And we're able to work with VaxiBox to increase that holding time to ensure that at any one point there is cold capacity for vaccines. But for now, we have a 12-hour battery backup.
Nora, maybe just also to chime in as per the other judges, I think your pitch was very well put and seems to be very well sort of researched and a lot of information gone into it. So I want to appreciate that. I don't have questions per se, because I think the questions that I had have really been already asked, really around data capture, as well as sort of, you mentioned after sales support, which was something that I wanted to also ask a question about. So I'm happy about that. Just to appreciate your solution. And really, for me, what is standing out is sort of the mobility of the unit, and appreciating your pitch, that if you do go through to the finals, the way you have pitched, which is ending with a connection to your problem statement, which I've been waiting to happen. I really do appreciate that. So I think those are all my comments. Thank you.
When we build businesses that are based on sustainability, looking at people, planet, and profits, those businesses will be businesses that will stay for a long time. So I'm happy with the innovations that we've seen. And as much as you'll announce winners, I believe all these participants are winners. Getting to such levels and having very well thought out ideas and pitches, I feel all of them are winners, just that maybe some were ahead of the others. But the future is very bright, and I wish all of them all the best. For KICC, I hope there will be a way of nurturing some of these ideas. We can also get in touch separately to see how we can maybe support some of the innovators jointly, just to make sure that they take the ideas to the next level.
So coming in at number 3, at position 3, we have none other but clean energy for food security. Coming in position 2, we have none other but Wahoo Magic Safety Solution. Coming at position 1 is none other but Drop Access.
Oh my god, oh my god, oh my god, oh my god, oh my god.
Hearty congratulations, Nora Magero, together with your team members.
Thank you so much. Thank you,
Coming
thank you so much.
Position 1, and you get to represent Kenya with Isaiah and Bronson having come at position 3, 2, 1 respectively. There goes your certificate of merit, and you get to walk away with a cash prize of Kenya shillings 150,000.
This is really, really exciting and really, really humbling, more so because I was going through each and every single presentation and just amazed at how Kenyans are so brilliant, the amazing solutions being put out there. And I acknowledge personally, like as much as we put in the work, there has been so much work that has been put, and there are brilliant solutions that create so much impact. But most important, I'm so grateful for KCAC and the CLP team, because when we got into this program a few weeks ago, We didn't know how to calculate our climate impact. We didn't know how to calculate financing. We didn't know how to, we didn't even settle down on tackling the healthcare, but they worked with us. They were very, very patient with us. They listened to us. They taught us, and they just gave us the hope in a moment when we were going to give up on a solution that we weren't so confident in. So this just validates the amount of work that we put in, especially my team, and congratulations to them too. And also thank you so much, CLP, KCSC, and the support that you've given us, and just thank you. I'm amazed and I'm totally grateful to the judges, to other participants. Thank you. And congrats to the other people. Yes.